you went to surgery to increase the size of your meat stick, would you still be able to impregnate a woman, or does it make it not work anymore? Chlamydia of your eyeball, the real reason so many people have a shorter left leg, and everyone secretly has a hole in their head. What? Today, I'm diving into the internet's strangest medical rabbit holes. From serial killer brain commonalities to does this animal hold the secret to curing rabies? Some of this is gross, some of this is hilarious, and some might just make you rethink everything you thought you knew about your body. Let's dive right in. First question, here we go. Bro, can you really catch chlamydia in your eyeball, or is that just some urban legend? Yes, you absolutely can. Chlamydia is a sexually transmitted infection, and if you get the fluid of which the bacteria is in and you touch your eye with it or it gets in there somehow, you can get conjunctivitis, aka inflammation of your eye, and it has to be treated systemically with antibiotics. A lot of times we cover both chlamydia and gonorrhea because they kind of go hand in hand, and you want to make sure you get injection of antibiotic. Most of the time we use ceftriaxone. Depends on your resistance in the area that you live of these infections. Kissing bug disease, what the heck is it? Yes, it's also Chagas disease caused by the kissing bug that transmits a parasite called Trypanosoma cruzi. And this kissing bug, it will bite you, typically mouth, face, while you're sleeping. And it's actually the poop, I believe, that actually gets in you and transmits this parasite. A lot of times it goes untreated. The symptoms that you worry about, fever, body aches, but a lot of swelling around the face and eyelids. And if it's not caught and treated in a proper time, it can cause heart disease, heart failure, and also can cause like something called toxic megacolon. But good news, if you do catch it early, it's simple, it's treatable. And also the untreated population, a lot of times you don't know you have it for so many years. So if you do have initial symptoms, really good to get it treated. When you are buried, do morticians remove all your organs from your body first?
You freaks are never getting our organs.
No, they don't. Unless there was a specific reason, like you were an organ donor or there was an autopsy that they needed to take the organs to test. But they usually do put them back. But in general, for the majority of people, the mortician, the funeral directors, they're actually embalming the human to actually preserve it so the body doesn't break down as quickly. They put this embalming fluid in the body to prevent the body from breaking down before it basically gets into the ground. You don't want it breaking down and having the byproducts of dead tissue just laying around when somebody's trying to grieve for their loved one. Wait, you mean to tell me that your pupil is actually a hole in your eye? Your pupil is exactly that. It is a hole without color to it. So you have your iris, which is the color part of your eye, that actually opens and closes basically, which then allows light to pass through the lens, which is the first part, and then go through the fluid to get to your retina. The pupil itself, that hole, is the opening made by your iris. It's devoid of color, but because there's no light in our eyes, so to speak, in the fluid itself, it looks black. Does milk make bad body odor?
Do you smell it? That smell. The kind of smelly smell.
Interesting question, but it can. It depends on you as an individual and the ability to break down its components, specifically lactose. So some people don't fully break down lactose, which leaves the byproducts in their sweat and their breath, and then the bacteria mixing in with that start making a little bit different smells that people could notice. So it's not universal, but if you do notice a little bit of funk after having dairy products, it might be something to look into, or maybe stay away from some of those dairy products. Anybody out there watching this lactose intolerant, let me know. If you went to surgery to increase the size of your meat stick, would you still be able to impregnate a woman, or does it make it not work anymore? So no, in general. So penis enlargement surgeries typically do not affect your sperm. So the sperm are hanging out in the testes, right? And then they get ejaculated out during intercourse. But surgeries could affect your erection, which then could lead to problems to impregnate a woman. There are other ways to go about it, but from a traditional standpoint. Surgeons could cut your suspensory ligament, which attaches to your pelvis, which could make a flaccid penis look longer, or, the idea that it could be a little bit longer, but it doesn't change the length of what you already have. I know rabies is 100% deadly, but is it true that possums can't get rabies? Don't you think we should study that for like a cure?
Oh, who's a possum? You're a possum. What's that? I'll tell you later.
So yes, possums can actually get it, but it's so rare that nobody really talks about it. And the reason why they don't get it is because their body temperatures run at a lower number. So they're lower than humans, and the rabies virus does not do well in that environment. So one of the main reasons why it doesn't really work in humans is because rabies spreads via the nerves, not just the blood. So that's why if you suspect that you have rabies, don't just jump in a cold plunge, get to the hospital and get your rabies vaccination. I was joking, don't jump in a cold plunge. Is it true that there are some people who are allergic to water? I just heard about it. Yes, actually, it's called aquagenic urticaria, and it's not 100% an allergy per se. It's a reaction to the water, and you develop itching and hives, but not normally going to have an anaphylactic reaction, which, including airway closures, systemic response of vasodilation. But I have heard of some people who do have, say, cold water urticaria, having to carry an EpiPen in case it gets really bad. Why do serial killers kill? Like, what in the world is going on in their brain? I want to know so badly.
What did you see, Clarice? What did you see?
So really good question, but there's really not one answer to it. It's very complex, and it has to do with differences in the brain, areas of empathy, aggression, and restraint. So they have looked at patterns of serial killers and have found that there is less activity in the prefrontal cortex and increased activity of the amygdala, which is like fear and aggression. Add that to potential childhood traumas, neglect, abuse, and it could be a recipe for a future serial killer, but not a guarantee. There are plenty of people out there that have this combination that don't become killers. Is it true you can go blind if you mix Viagra with certain blood pressure meds?
Mr. Sanborn, did you take any Viagra today? Mr. Sanborn?
So yes, and it's rare, but Viagra causes vasodilation, and blood pressure medications, depending on which ones, actually work to lower your blood pressure by multiple different mechanisms, and one of them could be relaxation of your blood vessels. When the blood pressure drops so low that you may not get enough blood flow to your optic nerve, which then could lead to blindness. So always be honest with the treating doctors. They're there to help you and save your life. We don't want to cause harm. I make orthopedic shoes. I've noticed in my customer base that a majority of my customers have a shortened left leg. Is there a medical explanation for why the left leg is often shorter than the right? Good question. And actually, slight leg length discrepancies are quite normal. Most people, if you cut them in half, the sides aren't equally the same, but we're talking a few millimeters. Now, when it comes to left versus right, majority of people are like right-sided dominants, and so they might put more weight or pressure on the right side, leading to that left leg being shorter or less stimulus to have bone growth. Do you have a leg that's shorter or longer than the other? Let me know in the comments. Why do we gag when we brush our teeth sometimes, but not when we swallow food? So when you're actually using your toothbrush, you're brushing your teeth, and it might slip and hit the back of your throat. It's hitting your gag reflex. It's actually protecting you because you're not in the mode of swallowing. You're not doing the chewing mechanism, using the muscles of mastication. Your brain knows these versus, something just came into your mouth and you're trying to block it from going basically into your airway. There are people out there that have a diminished or no gag reflex, and they have to be really careful because there's a chance that you can aspirate things into your airway up through your nose and not realize it, and you have to be really, really careful. What is the absolute best hangover drink? Sprite, Pedialyte, Gatorade, OJ, something else? Need to know before this weekend.
Ready to party!
So great question. I mean, any drink that's got electrolytes in it is going to be helpful to replenish what you lost when you're trying to metabolize the alcohol. Staying hydrated before and after is actually pretty important as well. Of the drinks, the ones that have the best electrolytes on this list is probably Pedialyte versus Gatorade. The one I would stay away from is definitely like milk, orange juice, just because they can cause irritation to the esophagus. There was a study that found that Sprite actually speeds up the enzyme for the metabolism or the breakdown of acetaldehyde, which is the bad byproduct of alcohol metabolism, to get it out of your system. So really cool. Big things is always drinking in moderation, staying hydrated, and getting enough rest. If you want something else that's in a supplement form, my company, Life Happens, has a supplement called Core Decisions. It is a pre-party supplement to help with alcohol metabolism and hydration. It has milk thistle, schizandra, rosemary, vitamin B6, and potassium in it. It is to help bounce back faster. So the sun produces UV rays that cause sunburns, and UV rays are a type of radiation. If I were to go to Chernobyl for a day, would I essentially get sunburned all over? Isn't a sunburn a type of radiation burn? Well, not quite. Okay, so sunburn is UV damage, which is a form of radiation, but Chernobyl's radiation isn't UV, it is ionizing radiation, which penetrates deeper, causes more destruction of tissues, and increases the risk of long-term cellular damage that can lead to cancers and other long-term conditions that can actually shorten your life. So if you went to Chernobyl, you wouldn't necessarily get a sunburn, but because of those ionizing radiation exposures, you're going to increase your risk of cancer and radiation sickness. Are shorter videos actually making our attention span shorter or brain rotting us? There is evidence that shows that constant short format videos trains your brain for those short videos and the novelty of it. You find that short video is going to give you a quick dopamine hit, and then you move on to the next. So then you're training yourself that when you watch a longer format video, it takes a lot more focus and you're not getting as much potential reward, so to speak. So then you're losing interest and don't want to watch those videos. Good news, like a muscle, your attention can be trained back to longer formats. And if you made it this far in the video, I know you've trained yourself well. Well, these are really good questions. Keep them coming. Lots of good questions out there. Make sure that you send them our way, any format you want. And if you enjoyed this video, definitely check out this playlist right here, Binge Watch Everything. And please make sure you subscribe, turn on your bell notifications, and hit that like button. Thank you so much for watching, and stay healthy, my friends.